internal laryngeal nerve off the superior laryngeal nerve off of vagus is going to innervate things like the epiglottis and the base of the tongue, as well as the laryngeal mucosa superior to the vestibular folds, also known as the vocal cords. And the most inferior demarcation of what this internal laryngeal branch off the superior laryngeal nerve off vagus innervates is going to be the false vocal cords, also known as the vestibular folds. So the demarcation of where the innervation of the internal branch of the superior laryngeal nerve off vagus ends is going to be the false vocal cords, aka vestibular folds. The next question then is, what innervates the true vocal cords, also known as the vocal folds? And the answer to that is going to be the recurrent laryngeal nerve. And so the recurrent laryngeal nerve is going to innervate some of the laryngeal mucosa, specifically on the inferior aspect, since the superior aspect is primarily innervated by the internal branch of the superior laryngeal nerve off vagus. And that recurrent laryngeal nerve is also going to innervate the true vocal cords, also known as the vocal folds, as well as most of the intrinsic muscles of the larynx. And so most of the intrinsic muscles of the larynx are going to be innervated by this inferior laryngeal nerve. Whenever we talk about the intrinsic muscles of the larynx, they are named intrinsic because their attachment sites are exclusively on the larynx. So whenever we say most of, that's because there is one exception to this rule. The one exception to this rule is going to be the cricothyroid muscle. And the cricothyroid muscle is an intrinsic muscle of the larynx, because just as we have our thyroid cartilage here, we have our cricoid cartilage here, and this muscle sits right here on either side. And that muscle is the cricothyroid muscle, named off the cricoid cartilage, and thyroid cartilage, named after its attachment sites, with our both laryngeal cartilages, therefore making it an intrinsic muscle of the larynx. And that is the one exception to the intrinsic muscles of the larynx innervations, which are primarily the inferior laryngeal nerve, except for the cricothyroid, which is actually the external branch off the superior laryngeal nerve off of vagus. So therefore, although most of the intrinsic muscles of the larynx are associated with brachial arch 6 because of the inferior recurrent laryngeal nerve innervation, the cricothyroid muscle, which is the only exception to that rule, is innervated by the external branch of the superior laryngeal nerve off vagus and is therefore associated with brachial arch 4.